This is our passing the NCLEX the first time, or crushing the NCLEX, as I put here on my little slide. You know, it's we're just going to go over a lot of different things on tips and tricks to get started, things you should be doing. Some of it may be obvious.
Yeah. I mean, some of it seems obvious, but you know, a lot of it is it's an anxious time, so it's good just to be prepared and know what's coming.
You want to make sure that make sure that you are a well-informed person. I think that's that's very good in general, because you want to make sure no matter what that you're prepared. And if you feel more prepared with anything, then you're more likely to definitely go and you know, do well and you know, just kind of squash the anxiety thing. We're going to talk a lot about anxiety, but you know, lots of different things. So without further ado, let's actually go ahead and get started. This is going to be about an hour. Anyway, my name is Dr. Kendall Wyatt. I work as the academic contact director here at Picmonic. So I started out as a paramedic, went to nursing school, then went to med school. And we have Marlee.
I'm the Master Nursing Scholar here at Picmonic. I help Kendall with the content, and together we do a lot of the videos on our YouTube channel. If you haven't seen that, it's on YouTube under Picmonic Video.
Yeah, so you can always find out lots of our stuff there. So let's go ahead and actually get through this. So if you've never heard of Picmonic before, what we do is we take images and turn them into fun characters. So like the hypo, it turns into hippo, and everything that's hypo is some type of hippo. Hyper is always a hiker. I know Marlee really likes this hiker that's on the screen here, but so then you're always going to see some type of hiker, and you can always see those images inside of a cohesive story, and we're going to talk a little bit about some of that stuff, but that's not what we're talking about today. But this is what we do here at Picmonic, is we do lots of fun images and everything. So, you know, you can see a magnesium magazine, which is a character, and you can learn a lab value. You can learn stories about a hippo magnesium magazine, and a hiker magnesium magazine, and then that's going to easily tie in to help you remember magnesium sulfate, the drug, and other diseases and things like eclampsia, and see how all those topics tie in together. So let me just hit one little button here just to fix something. Because I need to set something. Oh my goodness.
So many windows.
Yeah, there's like 500 windows. It's okay. I'm just gonna. Oops. Oh,
wow.
I don't think I was supposed to push the button.
Okay. Well. This is why live is great.
So if you're on a good webinar, which is where almost everyone is, nothing happened. But if you're on YouTube, I'm sorry.
Okay. So yeah, it looks like a lot of you are taking your NCLEX this coming month, which is so exciting. Wow. Yeah,
looks like great. So we're going to go ahead and get started, and we will put everything up here and get. I don't know. We'll fix the YouTube thing later. I don't know what happened because I don't want to bore you guys because everybody just get irritated. So Marlee, why don't you tell us what we're talking about today?
All right. So today we are covering the exam itself, about it, what you guys need to know. Then we're going to talk about understanding your weaknesses and making a plan to go forward, and then some last-minute things that you just want to keep in mind, and then success. And then we'll wrap up with a Q&A session.
Yeah. So we've got a lot of different things, a lot of different stuff we're going to be going over. Definitely for sure. So with that, the big thing really is first talking really just about the exam. And I think this is one of the biggest things that so many people, they hear a lot of misinformation, or they hear lots of different things about it, or, you know, they just lots of different, I don't know, different...
yeah, myths. And, you know, it builds this monster of an exam when really it doesn't have to be that scary. So we're here to kind of clear that up for you.
Yeah, so one of the big things with this, when we talk about it, is first just being prepared and knowing information about, you know, about it itself. And that is, so whether you're taking the, you know, the RN, NCLEX RN, or the NCLEX PN, you've got to be prepared. You know, everybody hopes that they get the minimum amount of questions. You know, you hope you aim for 75 or 85. But you really should prepare that you maybe need to take all of the questions. I mean, there's that possibility.
It's true, and I think going in thinking that you're going to do all 265 questions is really just the way you have to go in thinking, because Kendall, I don't know how many questions you had, but I had, I think, 102, And after I hit that 75, I started spiraling just because I was focused on 75 so much. And then so every question after that I had to answer, I was getting more and more scared.
So you were just kind of like freak out mode.
Yeah, I was freak out mode.
And that's exactly what we don't want to have happen. Yeah. And that's why one of the biggest things is kind of mentally prepare yourself that you need to do 265. Yeah. Because I can tell you as doing other things after nursing, so like going to med school, those exams are 8 hours long. And you have to, I just took 75 questions for nursing, but I can tell you one thing, when you're taking 265 questions, 6 hours of an exam, that's a lot.
Yeah.
That is a whole lot, and it's going to be very taxing on yourself. And you need to, as you're practicing questions and going through questions, it's really important to make sure you're kind of planning for it as it's a marathon.
Yes.
And of course, there's the breaks. So Marlee has some important things. What do you like to say about breaks?
I think you would have to take a breaks. 100% take the breaks. Even if you don't think you need the breaks, take the breaks. Because it's so nice just getting out of that room and getting just some fresh air and taking a sip of water and kind of recentering and going back in. It really makes all the difference.
As far as
just getting your mindset back into it. And I feel like a lot of times too, if you're getting in that anxious spiral, then you need to just step out and breathe and then come back in and focus.
Just kind of relax and kind of reset.
Yeah.
And I think that's a big thing. So if you're planning to go and do, if you're already planned for all 265 questions and you already plan to take your break, so there's there's a 6 hour maximum time for the NCLEX RN exam, and of course 5 hours for the PN. But if you go in with a mindset of I'm going to have to be there for 6 hours, and I know that I'm going to have breaks, so you're going to get a break, an optional break at 2 hours, and then at 3.5 hours. And if you take those breaks and then reset, and really just plan for it as ahead of time, and then you're going to be teed up the best, and you're going to be you're already planned for the worst. I always use the old adage, plan for the worst and hope for the best, and that's probably the best thing.
Yes, it really is.
That's super, super important here. I always like to say, prepare yourself mentally that you may have to answer all 265 questions or 205 in the PN case.
Right.
But if you plan that, then you've already planned for the worst case scenario, and what's going to happen is it's not that big of a deal for you.
Yes.
Then you don't have to freak out.
Yep.
So Amy asked if the breaks count against your testing time, and they do. They're optional breaks. You don't have to take the breaks. Ooh, it looks like your shirt coming back. Oopsie. So the breaks they're optional, but 100% recommend you take them. And also, you can take those breaks, and they truly should be resetting you, and then you can kind of get back in the mindset of, okay, I'm going to run back in for another hour and a half, 2 hour marathon of answering those next questions.
Yes.
And that's just really important for how it goes. So somebody always asks if we can see their messages. Yeah, we can see them, but because we're streaming on so many different platforms, you can't see everybody else's messages. So if you don't see any, that's okay. Sometimes we share them. And we got Matt in the background. And I think Matt's on YouTube as well, getting those questions in there, so we can make sure that we can answer them and get them as well. Now, the biggest thing that, and the biggest question everybody has is, what is this computerized adaptive testing, and how does it really work? Now, I always give this preface. I don't work for the NCSBN. I don't do anything with the exam itself. So these are kind of, this is my take on these things. But they're mostly accurate. Yeah. So there's a couple of technicalities there's more information for these. But how does it work? So you come in and you're going to take your 75 questions, and you're going to start the exam. And there's 3 basically ways that it determines if you pass or fail. It determines basically you have to take a minimum number of questions, and that is 75 or so questions that you need to take to get the minimum pass. But it's going to first off use this 95 confidence rule. I know, Marlee, statistics is one of your favorite subjects, right? Yeah. So I love numbers, but it's basically, it runs an algorithm based on you getting the correct questions right or wrong, and the difficulty of those, which I don't know any of that stuff. That's where I'm speculating on a few things, but it is true. It's going to come up with this confidence interval that's going to say it has a 95% certainty that you're either going to pass or you're going to fail.
Mm-hmm.
And if it gets to that number and shuts off, then it's decided basically that you're with a 95% accuracy that you're going to pass or fail. That's where most people they go above 75, and that's where that anxiety comes in, because, well, it doesn't think I'm going to pass.
Yeah.
And that's okay.
Yeah.
Question 76, you just need to take a deep breath and say, I'm still in there.
Mm-hmm.
Because the algorithm, the 95%, it's not sure that you're going to pass yet. So it may be giving you maybe a little bit more questions, but less difficulty.
Mm-hmm.
One of the things that is out there is that essentially they assume that you have a 50% chance of answering some of those questions correctly. And that's kind of the algorithm that they use, as well. So the next one is what happens if you have to take all the questions? The minimum length exam. So basic or maximum time length. So you basically used all 6 hours, but you've not answered all the questions, you ran out of time, essentially. So we're not running out of time, but what's a good word to say that? Way to say that, Marlee. You've used all the you've hit 265 questions. That's what I meant to say. So you've taken 265 questions. It's going to basically then take those 265 questions and determine whether you're above the passing standard or below. Okay, that's acceptable. So essentially, you either are good enough or not, and it's going to determine based on the 265 questions or the 205 in the PN case of what you took. And then the last one is what I was trying to confuse, of course, is when you run out of time. And that's, you may have taken 200 questions, but you took 6 hours to do all 200 questions. And this one's difficult. There's a couple of special scenarios with this, but basically what it's going to do is it's going to take all of your history, and then it's going to look at the last 60, and then it's going to determine if you are above the passing standard there, and then give you a pass or fail. But I can tell you the best way, and the best way to pass is with the 95%. Well, number one, because you're not going to be exhausted. But if you hit 265, which is the next one is people hit 265 questions in like 4 hours, then it's just going to determine whether you're above or below the passing standard. But with it, one of the things we always say is, if it gives you 75 questions, and you hear this all the time, and they're like, oh my God, I had 75 questions, and I had nothing but select all that apply questions. Sorry, my mouth gets dry. Yeah, I know. I got my magic orange cup. But if you hit that 75 question mark, well, then you have to, then it's going to basically say, okay, well, we got to 75, and then if you're not above, if it doesn't have a 95% confidence, then it may give you easier questions. And that's the part that's speculative, but it's essentially going to give you less select all that apply questions because it just needs to see if you know it. And let's just use a dumbed down version. Dumbed down, maybe not the best choice of words, but if we have one select all that apply question, that's going to give you four answer choices, right? You may have to know 3 or 4 answer choices for that, so that's like 4 questions. But if they ask you those 4 questions in a different way, or 4 questions in the same area, and you get all of those right, then I think that's why you may have to take more questions, and that's a lot of the speculation of how that works, because those are perceived as easier questions. As somebody who writes lots of questions and does a lot of educating thing, the select all that apply questions are always the most difficult because you have to know lots of pieces to get them all right, and all the pieces. My favorite.
I think what's important too to remember is that if you do get all 275 questions, that you can still pass.
Yep.
That's what a lot of people don't. They think they got 275 questions and they're done.
265, but yes.
Sorry, 265.
It's okay. See, I like this because then we can just correct each other.
I know, but you know what I mean. It's like you did not fail necessarily if you got them all.
Yeah, and I have several friends and colleagues that have had taken all 265 questions, and they seem to take it in about 4 hours or 5 hours. They don't, I don't know anybody who's ran out of time personally. I know users have written into Picmonic before and ran out of time, and lots of other people. But you know, the biggest thing with this is if you plan to do all 265, and when you're practicing questions, which we're going to talk about in a bit, is you're planning to only take 1 to 2 minutes per question. And I think that's a lot of where, maybe we're going to mention this in a little bit, but when you're practicing questions, you really need to make sure you're not just flipping through them, because you know, you can't just flip through questions and think that you're going to do okay. So just a couple other things about the exam itself and some things to make sure you know. In case you're not practicing these, I don't want you to get scared. Oh, it looks like my little YouTube video has actually got a little clip off the end, but that's okay. Is to know that there's, you know, alternate item formats, they call them. I love all these terms. But you know, so there's some drag and drop. There's labels. So you may have to choose where heart sounds or lung sounds go. You may have audio ones. You may have put these in order. So I see that one a lot with like mixing in pH and regular insulin, and they put the steps there. You've got to put them in order, or you know, the steps to start an IV.
And then there's like reading an EKG.
Yeah, a couple of those other ones, kind of, you know, steps of things you need to put in order. But that's important to remember, that there's just these other multiple test formats. So if you're practicing test questions, that's where a book is really difficult, and some of the software that's out there and programs that can help you out. The other one,
generic medication names. So the NCLEX does not use generic medication names.
Trade names.
Trade names.
You're flip-flopping all day today, man.
I got all mixed up with all the windows.
Yeah, there's like 6 versions of us on the screen, so it's a little confusing. But what Marlee meant was, so in the NCLEX, you're not going to be given the trade names of the medication. So you're only going to be given the generic medication forms, and this is really important because we'll see like you know, Coumadin, warfarin, you'll see Lasix, furosemide, yes, and you need to make sure you know those the chemical names, the generic names, because you may not get the trade names, and if you don't get it, then you know, you're going to miss a question. So just make sure when you're learning, and I know it's hard because of the, you know, the clinical side, but you want to make sure that you are
studying just the generic names.
Make sure you're
almost forget about it. I remember you used to tell me that all the time. Just forget about it for right now.
Yeah. Oh yeah. Yeah. So Marlee started working for us actually before she took her NCLEX, and we're going to talk about that here in just a bit. But the other thing, another important thing is so the math questions. This is a big one. Lots of math questions on that may be on there. I'm not going to say you're going to get a lot of math questions, because I know a lot of people are freaking out. And I can't tell you how many you'll get because it's, you know, of course, random. But you will have to do math on the NCLEX. It's very likely that you may have to just give a dose of a pill or something. But it's going to tell you essentially any crazy math, and it's going to tell you if it wants you to round at some certain point. It's usually going to tell you the format of what it wants you to do. And of course, the fail-safe at the end is then just round at the end if you have to. But it's almost always going to say what you need to put in there. It's only going to give you that many boxes or whatnot. So it has to match, and that's super important. But there's not a lot of rounding that's in there. But the other, you know, the thing is round at the end is pretty much the general rule for it, so you don't have to freak out.
And just so you guys know, there is a calculator on the exam, so you don't need to bring a calculator.
Well, they won't let you in anyway.
Right, they won't, but you'll just have one in the corner, so
and
no worries about that.
And very last, we're going to talk about day of exam things, so some prep for the day of, and that's at the very, very end, in case you're just sick of listening to us at that point. But so another really important thing, I see this one a lot when people are practicing questions, and it's really important to know that when you're taking your NCLEX, you can't skip questions, you have to answer every single question right then and there and choose an answer, and when you go to the next one, there's no going back. That's because it's going to determine whether you got it right or wrong and move that 95% confidence interval, you know, up or down, whether you're going to pass or not. So it's really important. And why is that important? Okay, good, you know it. Well, you need to make sure you're doing that, practicing questions before you go to actually exam day, because if you're one, and I know you're out there, I know there's a bunch of you that are going to write in on this one, if you're somebody who changes your answers all the time, or you always are going back and reviewing the whole test and going through and changing your answers, you're not going to be able to do it anymore. And by default, that's a bad thing to do, really, really bad. So don't do that.
Right.
No, that's you. So I just got this slide in here. This is actually from the NCSBN, from the test plan, which you can go to the NCSBN's website and see a lot of these. There's a great FAQ, some other questions of things that are in there. But it's just to kind of show you that there's a large mix of types of questions that are going to be hitting you up potentially on your NCLEX and what you should be studying. But the big thing, and the one I just like to point out, is there's lots of management of care. So it's really important as a nurse to be able to choose what, what you should be doing next, or what the action should be, and that's whether you need to assess the patient, or whether you need to, notify the physician. I've lost my mouse again. Okay, there it is. And things like that, really, really important to make sure you know. Just stuff like that to make sure that it's working for you. Mm-hmm. So that you're studying all the information, because you can't just pick just one. And that's what is important is, and I don't think I said this, but you have to be passing in all of the areas. Mm-hmm. So, I mean, I like to use it by course, but they don't necessarily do it by that. But you need to be passing in every single area. You can't just ignore one. Let's say you're not very good at obstetrics. Mm-hmm. You can't. Yeah, I know. I get a lot of obstetrics questions right at the end of my test, but and I'm assuming it's because I was missing them. But you've got to be able to, above the passing level in each area, so that it's a cumulative, overall. You can't just kind of forget one, mm-hmm. And forget one, one area and just say, well, I'm not gonna study that. You got to study everything, and kind of come up to the level on every single area. That's really important.
Yeah.
So,
yeah.
Yeah.
That's true.
So next, I'm gonna take a little drink here. Mm. I get so excited talking about all this stuff, then my mouth gets so dry every single time, never fails. So next I want to talk about really gearing yourself up for the NCLEX. So let's say, you're doing great and you're ready to go and take your test, or you're ready to schedule your test. I really want to just talk a little bit about understanding your weaknesses and getting a good, and then we're going to talk about the plan, of course, mm-hmm. for what plan you want to make. Now, before this, lots of people are writing in some very specific questions, some very, very specific questions, and we're going to be going over those at the end. We're going to do a live Q&A. We're going to go through your questions so you can save them to the end. If you have some questions in there, I see a couple of you have posted the same question again. I'm sorry. If it's not exactly relevant to what we're going to get it at the end, and we'll do 10 minutes or until Marlee just passes out from exhaustion to get your questions in there, because there's usually lots of good questions mm-hmm. that we also use for other webinars and whatnot. So moving on to understanding your weaknesses. So with this, everybody, this is the one where I kind of get really, I'm trying not to be harsh, and everybody always ends up thinking that I'm a you-know-what hole. Because somebody writes in and they say that they failed and they failed a couple of times, mm-hmm. and I don't want anybody here to go through that. So I want you to right now be very honest with yourself and say, okay, where do I stand? Mm-hmm. Marlee, where do you stand? She stands wherever she wants.
Exactly.
No, so you really need to just be honest with yourself and say, okay, where do I stand? What kind of a student am I? Do I have good study habits? Mm-hmm. And look at most schools, and this is by survey of Picmonic users, about 85% of all the schools require some type of exit exam. And if it's optional, I recommend you take it, especially if it's a HESI or an ATI exit exam, because it's going to give you this really great indicator of all these areas of where you're just not very good at. Mm-hmm. And it's going to help you pinpoint some of the ones you just honestly just kind of suck at. And you need to go.
It's like a reality check,
Yeah, and those are painful. Nobody likes to do it. I don't like to do it. I don't like anybody to tell me that I'm stupid in an area and I'm not very good. But those are really great, and get those assessments, and you want to have that baseline for where you're at. Mm-hmm. So you can use those. The HESI is the most popular one, according to our survey from our users. But and I believe it is the most popular one. Mm-hmm. But that's just my tagline, so that Kaplan or ATI people don't get mad at us. No. So if you follow the HESI, they actually have that predictor. So if you get above a certain number, they're actually almost, they're saying with a high probability that you're likely to pass. Mm-hmm. And those are really good. So if you're able to do those, I know they're expensive and they cost more money, but they're really good for you to make sure that you can do them. Mm-hmm. But with that, you can also just use your course exams.
Yeah.
So Marlee will take her 20% from, obstetrics and go with that.
Yeah.
No, I'm kidding. But if you took your course exams and you see that you did really poorly, try not to rationalize, that you had a bad instructor, even if it's true. Because if you had if you got a poor score, it's genuinely because you just didn't do very good in that area. And I'm sorry, You know, that it's just kind of one of those things where the facts hurt, and you just kind of have to live with it. And then also just where did you struggle? I mean, I always hated OB. I'm okay with it now because after I went through OB and then had to dissect all those placentas and then went on to med school and had to do even longer OB rotation. I'm okay with it now. I've got over my qualms. But, you know, back then I knew that OB was going to be my pain point, and it was. And so that's where I really had to go and review a lot of OB all over again because I just really hated it. And you don't want to, I don't know, you don't want to suffer on the exam because you don't want to risk it here.
Right. You don't want to, even when you're studying, and it is a struggle when you have to study something that you don't enjoy studying, but then you can really go in with confidence knowing that you know that.
Yeah, or that you just reviewed it.
Yeah.
I mean, make sure you're reviewing your weakest stuff.
Yeah. Now
with this, I find that just through my own doings, as we'll call it, I found that there's three main areas that students really struggle, and this really comes from years of me teaching, and a lot of it, well, a good portion of it also comes from just literally doing webinars with thousands of students, and they all write in all the time, and it's kind of divulged down to people usually have trouble in three areas. So one of them is you just don't know it. You just don't know it.
Yeah.
So, you know, what are the signs and symptoms of placenta previa versus placenta abrupta? I don't know. You know, if you don't know, you don't know, and that's okay, because then you've identified that you don't know, and you can go review it or learn it or whatever. And then the other one is just understanding how to choose the answers, and that's comes back to maybe prioritization.
Yeah.
You know, which one is the most correct. And I would like to think, it is my hope, but I know that everybody's different, or some people have been out of school for a while. But you know, it's more of an exercise of understanding how to choose. We're going to talk about you know, practicing questions. And then the last one is my favorite. Marlee?
My favorite, anxiety.
Yeah.
It trips me up.
So Marlee has major test anxiety, so she actually gives some good advice we're going to talk about last of day of, because test anxiety is real. I also have test anxiety. I don't know anybody who doesn't have test anxiety, but it can become debilitating and make you become out of your element and make bad decisions or rash decisions. And we've got some good stuff on that. So lots of people are writing in on about different topics or different topic areas that you might have some questions about. So we do have lots of videos on our YouTube. You can check those out. We do have different ones on YouTube. You can go check out some different videos. Plus, just for content in general, you should check out Picmonic for the actual content itself. So let's talk about putting some of these weaknesses into a plan. Putting weaknesses and forming a plan. So what's your plan? And I think you know, this is where I just need a stick for some people, like Marlee. Even when she was, you know, she had finished school, she came to work with us for actually doing a lot of video things and other things, and she hadn't taken her NCLEX yet. But the biggest thing is, you know, you've got to set some goals, and those goals sometimes sting a little bit, I think.
They do, and I think the longer you put it off, from personal experience, the longer you put it off, the more scared you become to take it. You know, and Kendall was pushing me the whole time. You can just set a date. It's like, okay. So I kept setting a date and then pushing it back, and then every time that new date would approach, I would get so anxious. So I would push it back again. Yeah. It's a terrible idea. Do not do that.
So yeah, that's a good bad example, or a great bad example. No, so here's the point. You've got to pick. You got to set a goal, and maybe I got my slides out of order here. But the biggest thing is, you know, you guys are going to be finishing up. You probably, everybody who's watching this, if you're taking the NCLEX this year, unless you're taking it in December, you're going to finish all your stuff. You had to fill out your application for your particular state. Marlee's different because she was actually coming from a Canadian school to the U.S., so hers was much different. But you have to fill out your application for your particular state, send all that in, and then your school submits the information to the state, and the state's going to give you your authorization to test. Now, I have heard really horror stories sometimes about people that have waited to fill that application out for the state. My school made me do it in like February. I'm actually glad that I could say February correctly. This is one of my catchwords. But so the point is, you need to fill it out. If you haven't done that early, that all should be done by now. If you're planning on testing for the big season in June. But then your school's going to finish all your information. They kind of have to like put the final stamp on you and says, yep, you're good to go. I'm ready. You know, this school's authorized you to test. And then the state sends in your information. You have to be registered through Pearson VUE, and then you're going to get that authorization to test letter. Once you've got that letter, that's your ticket, right? And that's where I always say, pick a date. That's where once you've got your letter, you're picking a date. So let's say today is April 25th, I think. April 25th. Let's say I'm going to take my test May 25th. You know, May 25th, I'm going to take my test. That's 30 days, and I go in and I schedule it. And I pick that date and I schedule the day, I set the date, and it's done.
Step 1.
That is the most important step, Marlee. Marlee didn't listen to me, but it's really important to pick a date, because what happens when you pick that date is you're forcing yourself to say, okay, I've picked a date. Now, yes, you can move the date, okay? And there's you know, there may be some fees if you wait too late, but you've picked a date, and then you can work backwards from that date. And one of the things you need to do is set your practice question goal, as I've got here on the screen. So you really need to pick how many practice questions you're going to do. So, Marlee, how many practice questions should we be doing?
I would say about 2,000.
Yeah, the standard is, you know, around 2,000 questions, and everybody says, oh my God, that's a lot of questions. That you should be doing around 2,000 questions, and because most people you're going to get some right, and you're not going to review them all correctly, and I always say this, you need to be reviewing those questions. You really should be reviewing the questions, whether you got them right or wrong, to really ask yourself again, you know, would you, you know, I don't know, I lost my train of thought. So you should really be reviewing those questions and seeing, you know, if you remember the information, or if you just had trouble answering the question. Or you just somehow freaked out during practice questions. But when you're doing practice questions, what you should be doing is really assessing yourself hard on those, and maybe even just keeping a tally after you do a block of 50 questions. But don't do all 50 questions in OB. Yeah, I know I said if you. But you love OB. Yeah, if you're reviewing your weaknesses, you need to make sure you're trying to randomize the questions as much as possible. Yeah. Because if you're just most question banks, and even as a person who writes lots of questions, you're going to see, let's say I'm in OB, I'm going to ask you a question about abruptio placentae, and then I'm going to ask you another question that's probably very similar, but it's going to be about placenta previa. And then in the rationale, it's going to explain both of those together. So if you're doing them back to back and reviewing both rationales back to back, you're not really truly assessing yourself, and it's going to maybe falsely inflate your score. So you want to make sure you time the questions as much as possible to force yourself to getting that 1 minute to 2 minutes answers. So you should not be taking more than 120 minutes to take a set of questions. Otherwise, you're going to possibly be at risk of running out of time on the actual NCLEX. So you're just kind of conditioning yourself. And like I say, the NCLEX or the USMLE as med students, or the PANCE as a PA student, or any of the FNP exams, no matter what exam you're taking, they're marathons, they're long exams, and you've got to be prepared for taking and practicing a lot of questions. So lots of people are asking how many questions per day, and somebody asked 2,000 questions per day, and no, Amita, that's not what we meant. But along with practicing your questions, we're going to talk about how many questions a day on the next slide here, I think. But you condition yourself not to change your answers, because when you go to the NCLEX, you can't do that.
You can't, and go with your gut. They always tell you to go with your gut, and it's always right. I mean, not always, but most likely. Yeah,
you should. The right answer. Whatever you're thinking at first, usually your initial response, as long as you condition yourself. And we've got a great webinar on how to answer NCLEX style questions. There's a lot of pointers on making sure you read the whole question and going through all that stuff. We're not going to do that today. And then, of course, anything you have trouble remembering or you're struggling with, we recommend Picmonic. If you can't remember anything, you can always go check a Picmonic. And as I like my new catchphrase, there's probably a Picmonic for that. Yeah. Anytime that you're getting anything wrong, you can go and probably find a Picmonic to help you memorize those facts, as well as there's lots of other supplement review sources and review books. I recommend a couple of big ones, though. There's a great HESI review book that I really like, and it's a really good book because it really kind of, it's almost like a bullet-pointed list of everything, so it really just kind of chunks everything down. I don't really recommend going back to your course books. Don't go and get your Med-Surg book out and try to leaf through tons of pages, because all of that pathophys and all that extra crap is just really not worth it. You don't need to know any of that stuff. What you do, but I mean, it's just going to bog you down when you're really trying to study. So reading rationales in your questions is going to keep you kind of pointed and give you a good overview of everything. And then if you use a review book, then you can kind of stick to just like a review topic as area. So everybody says lots of questions. How many questions do I do every day? And this all depends on every person. I mean, the average, and this is just from our surveys and whatnot, but the average nursing student usually takes about 3 weeks or so of true prep time. Of like true, I'm going to study for my NCLEX. Yes, I know there are people out there that studied for 1 day or didn't study at all, and good for them. I don't think you should aim to be that person. That's a bad goal, bad you. Don't do that. But I also don't think you should be the other extreme and think you need to take multiple months unless you have literally got an absolutely atrocious score on your exams, and that's where you need to think about remedial resources before you go and test again. But how many questions should you take? So if you picked a date of a goal, let's say you picked a test date of next month, so May 25th, and I'm going to do 2,000 questions. Well, then I'm just going to take my 2,000 questions, I'm going to divide that by 30, and I'm going to end up with however many questions that is per day. And I'm not very good at that math on the top of my head, but I thought I wrote it down, and I guess I didn't.
I think it was
So somebody's going to do that math for me, and then they're going to think they're going to just call me stupid.
I think
so it's about 66 questions a day.
Yeah.
For if you did every single day.
So Kendall and I were talking about this earlier too. Beating yourself up if you don't get to that specific amount of questions per day that you had on your schedule.
Yeah, so if you're going to do, let's say you set a plan, and you've created a plan just like this. So you picked how many practice questions you're going to do. You've decided whatever question bank you're going to use. And then you say, well, I'm going to do 66 questions per day. And that's okay. When we say, that you, what's the question? Well, what's this thing? You miss a day, right?
Yeah.
Well, you just take the same number and you divide that by how many of the days are left. Now, if you miss a week, Marlee, then you need to work harder because it's not an okay. You really got to be dedicated. And I find lots of nursing students, they have good study habits as far as studying lots of content in a very specific area. But when it comes to the NCLEX, they can't create their own plan of nothing because you got to just kind of create it out of your own ear. It's all for yourself, and you don't really know what to do. So somebody wrote in and said they did really poorly on an ATI exam, and they were told to do 6,000 questions. Oh, wow. And I think that's completely possible, but you just can't do the same 1,000 questions over and over and over, because that's where if you do really poorly on any type of genuine assessment, you really just got to take a step back, and you just got to take a deep breath, and you got to be honest with yourself. Maybe have a glass of scotch, and be honest with yourself of why you're doing poorly. Is it because you're having trouble answering the questions? You don't know which one's the most correct answer. Maybe you just can't recall all of the the 187 drugs that you need to know, 500 drugs, whatever it is. All these things you need to know. You can't recall it, so it's not the tip of your tongue. So then you spaz, or you're like Marlee and you just literally freak out before the exam and have a meltdown. So you really got to ask yourself that hard question, and once you come up with that answer, and I like this good example of the 3 whys. Lots of business people, I watch lots of podcasts and listen to lots of things, but there's a really good thing of the 3 whys. So it's like, why did you get a poor exam score? Why did you get a poor HESI final exit exam score? Why didn't you get the passing standard? And you answer that question. And usually the first one's very easy. Well, because I didn't study. Or, well, because I just didn't know the stuff, or whatever it is. And then you ask yourself, well, why that? And you ask it again, and then you're going to then realize that, well, why don't you get it? Because I didn't get enough answers correct. Well, why didn't you get the answers correct? Well, I didn't get the answers correct because, and then you're usually going to get something in some meat in that second one, because I always choose the wrong answer, or because I rush, or because I didn't study enough, or because I wasn't prepared, or maybe even life happens, or something, and if you just kind of just keep being very honest with yourself, asking those whys, I think you can get you can get into a lot more information. So here's just our cute little just a cute little math thing I did. So if you say you've got 30 days and you're going to do 2,000 questions, and you need to do 60 questions a day, 66 questions a day, and we say that you're going to take 1 to 2 minutes to take those questions, so that's 2 hours, and then you need to spend the same amount of time reviewing those questions, so another 2 hours, and that's 4 hours. So then you have 4 hours of total review time for a month. That's a lot of time.
It is. It is. I think also you have to go into it. When I went into it, I hadn't been studying for 4 hours every day. So I think that's also part of it, is to make sure that you build habits out of your studying. I couldn't just go in from not studying at all to 4 hours a day. you know, so I put in an extra week of buffer to make sure that I'm going to build up to that 4 hours every day.
Yeah. Yeah, and I think a lot of people, it all is going to depend. So maybe you're going to be getting 75% on your questions.
Mm-hmm.
Well, very, very good. So then you don't need to review as much. So you're not really going to spend 4 hours. Maybe you don't take 2 minutes every single question. So you're not going to take 2 hours to take those questions.
Yeah.
And that's really where you're going to see a lot of that stuff yourself. Yeah. So just this is kind of, again, just the same information again on the same slide. But, you know, practicing questions and reading rationales. If you're having trouble understanding how to choose, really just practicing questions is the best way to do it, unless you're doing really poorly. And if you're doing really poorly, then you should probably take a step back and think about, you know, other options. And then if you just have a knowledge deficit, so you just can't remember which, you know, what the drug-ending beta blocker is, then you can use a great resource like Picmonic, which of course we work here, so we love Picmonic. But you review books, and if you're absolutely one of the things, if you're just somebody who's not very prepared, you're just not very good at planning, you can always do a review course. Review courses are expensive. They are very expensive, but they are very effective. And a lot of people they're going to put you on a plan, and it's going to you're going to go through a boot camp per se. And sometimes I find that works very well for a lot of people who are kind of on the fence, or some people who just they're just not very good at creating a plan, or they want to do a rapid review of everything. If you have a lot of knowledge deficit, I don't recommend a review course, because then you really just need to figure out why didn't you remember all the content? Because you shouldn't have passed.
Yeah.
And I know that's funny.
So harsh.
And it is harsh, but the reality of it is, and I worked with one school, and they a lot of their students had cheated somehow, and then they got to the end, and they just 3 of them failed their NCLEX, and they were like, oh, well, the NCLEX is harder. Well, the reality of it is, if you didn't learn the content, you shouldn't expect to pass. And, it's just a pain in the butt. Yeah. So here's a couple of questions we've got, and these are some questions we get a lot. So Marlee?
So how long should I prepare? And that, again, is like what we were talking about. It really depends on you, but generally 3 weeks to 4 weeks is a pretty good time.
Yeah, pretty average. Pushing it out, again, bad idea. Don't push it out.
Don't do it. Don't do it.
Get your ATT, pick a date, work backwards from there. And I'm telling you, there is so much stuff out there about people who push out their test date and then ignore it. And if you just imagine that you put like a whole bunch of sand in a bucket, and then you put some holes in that bucket, and that sand just starts to trickle out. And the sand is all the facts of all these crazy facts you need to know for the NCLEX. Well, if you put holes in it, over time, that sand is slowly going to work its way out unless you're putting more in. So then you have to work even harder to get up to passing level. Yeah. And that's where we get, hundreds of people write in all the time, and they say, well, I've been out of school for so long, or I took a year off before I took my NCLEX, and then I failed it twice. Well, you've got a lot of work, friend, to get. You got to review a lot of content. You almost have to go spend as much time as you've been out of school as if you were in school again to be able to truly take it. You need to take it right away, and I hope I beat that to death enough.
It's true. Just rip off the Band-Aid.
Yeah. So then how many questions we do? I think we got that.
Yeah, we got that one. About 2,000 we recommend.
Yeah, I think that's a good minimum. And then should I take a review course? I think we also kind of covered. I think that's up to you. If you've got a lot of money, I recommend it 100% because it can't hurt. And review courses, we're very, at least I'm very partial to Hearst. I think they're great people. It's something you can go try and use. And they've got a great review course, but I don't know that it's for everyone, and that's important. I don't know that everybody does need one, but if you've got the money, I will do it, regardless, because it's just going to give you that much of a higher chance, because you're going to be reviewing a lot of topics and a lot of high-yield points. It's super important. And I think we talked really mostly about how Picmonic's going to help you really just review lots of those topics as well. So before we get to our live Q&A, we're going to go through some last-minute things, as far as last minute is like things you need to do the day of, the week of, or just maybe things you
just didn't really think about and will definitely help.
Yeah. So Marlee?
Well, I would, number one, don't freak out, because I think at this point in the game you should know your stuff. So freaking out isn't going to do anything for you.
But didn't you freak out?
I did. This is all from personal experience, looking back.
So it's very easy to look back and be like, oh yeah, just don't freak out. It's so easy.
It's so easy, guys.
So I think it's if you know you have anxiety, I think it's important to identify that you do, and it's kind of like maybe even like alcohol, alcoholism or something.
Bringing it into awareness.
I have anxiety, and then realizing that you have it and that it is maybe debilitating.
Yes.
Then you can make a good plan. But this stuff works for whether you're any person, not just somebody who has a lot of anxiety.
Right.
Because they're just really important things. So go ahead, I'll shut up now.
No, just make a game plan for the next day. So this one is really important, I think, when you're really stressed out about everything else going on, to have things in order for the next day so you don't have to have extra stress on top of that.
So you're talking about like the night before your exam?
Yeah. Okay. So the night before your exam, make sure you have a game plan for the next day. And we were talking about earlier, map out, like I said, I almost ran out of gas in my car because I was so concerned with everything else going on. I didn't think about gas in my car. I didn't think about mapping out the route to the testing center.
I don't think you think about that stuff just in normal life. And I don't know if you guys are like Marlee. I try not to make broad assumptions about groups of people. But, it's really important to think about this stuff and really try to plan it out. One of the things that happened to me was also actually traffic. I took my test in Columbus, Ohio. I'm from West Virginia, but we're in Phoenix now. But I took my test in Columbus, Ohio when I lived on the East Coast. And I was from a tiny town. I mean, we don't have traffic. Traffic doesn't exist. So I went to Columbus, and my testing center was like 15 minutes from my hotel at 10 p.m. at night. And then at 7 in the morning, it was 30 minutes, and I didn't take in that account. So it is important to make sure you have to show up at the testing center 30 minutes before your testing time. So you're going to get a time. You need to show up 30 minutes ahead of time. If you show up at 25 minutes before the test time, it's okay. But it's not okay to plan for 25 minutes because they have the right to refuse you if you don't show up at 30 minutes. And that's really important, and that's where you're just going to put on that really nice friend face, and you're going to walk in there like you're not about to cry, and you're just going to keep it together. Because I showed up about maybe 20 minutes, I don't know, before my test time, and I walked in. Luckily, there was a line because I took the earliest spot. And I walked in, I'm like, oh, I'm here. Nobody can prove that I wasn't here 10 minutes ago because there's a line, and it was okay. But I literally was panicking, and I had to actually de-stress and calm down.
Just from that event.
Just from that alone, and that was me, and I don't really have a lot of anxiety, but it did. You don't want something like that to kick you off the horse per se, because 75 questions are going to go in an hour and a half or 2 hours. So that's important. So
and then make sure you have the proper ID. So this is an ID, your driver's license, your passport. Yeah,
photo ID. It also needs to match your name. The name on your authorization to test, it must match. So this comes up a lot if people get married or they don't have the right name on there. And you're gonna, if your ID does not match that authorization to test letter exactly, you may have problems. So I have a problem. I actually had a problem with this too.
Did you?
Yeah. So my authorization to test. So I always use W.M. Kendall Wyatt, right? But my real name's William.
Right.
And my ID didn't have K on it, so it said William Wyatt. So the lady was like, is this really you?
Should I let
you
in?
I'm already spazzing out, but it's important to then think of that stuff and then maybe just call, because you can always call Pearson ahead of time and see if any of that's okay. They'll double check it for you, or you get a new license or whatever. But luckily I actually had my passport in the car, so I just went and grabbed my passport because I took 2 forms of ID, even though you only need 1. So
just be prepared. Yeah, and then mapping out the route like we were talking about, making sure you know how much time it actually takes you to get there. Laying out your clothes, that one helped me. I know it's kind of silly, but it's just cuts out time.
I lay out my clothes every day.
Oh, well, lucky you. And then also setting, if you're taking your test in the morning, setting some extra alarms. I know you hate when I do that. Kendall and I were just at a nursing convention, and we were sharing a room, and he hates when I have multiple alarms. It drives him nuts.
Marlee believes in the snooze button times 7, so it's very annoying. But
I think in this case, it's good, just in case.
Well, a lot of people have trouble sleeping, and there's always that. You wake up and it's like, did I set my alarm? And it's like 1 a.m.
Yep.
And you just went to sleep like 15 minutes ago. Everybody, that's happened to everybody. But if it happens to you ever, it's going to happen the night before your NCLEX. So just make sure you're setting those things, and it is important. Set a couple of alarms, and that way you know you've got it, and you don't have to worry.
Yeah.
This is the only time I think that I will ever say that I think it's okay to have multiple alarms.
On to that.
But it does work, and it's help. And also just making sure if you having a good night's sleep.
Absolutely. And that's tough because you're so nervous.
Well, let me tell you what not to do. It is not the time, the night before your exam, to try Ambien for the first time. Okay? If you have trouble sleeping, no.
Chronic
If
insomnia.
anybody who has trouble sleeping, or you think you may have trouble sleeping, one of the things you absolutely should not do is try anything new that you've never tried before the night before a giant exam like this. So if you've never taken Ambien, you all should know this. Ambien can cause bizarre sleep behaviors, and it can also cause you to be groggy the next day. It can cause a whole bunch of problems. So any of those medications, anything to sleep, even like ZQuil or any kind of Benadryl basically, or diphenhydramine, because we're not going to use the trade name. But it's really important to make sure that you're not trying anything new. Use the same routines you have, or make sure you've tested whatever you're going to do several days before the actual day of the exam. I don't know how many times when I took my paramedic exam, I'll never forget this as long as I live. So we all kind of took our exams the same day. Well, lots of us took it the same day, and one of them was just like, he's super anxious and he drank a beer before his exam.
Oh, wow.
Horrible idea.
Wow.
Guess what? He failed. Okay?
Don't do that.
Don't try something new that you've never done before right before the exam. Raya actually writes in and says, I'm not sure if you're he or she, sorry, but they locked their keys in their car the last time, and then they had to go actual test.
Oh no.
And I think you just kind of gotta just take a deep breath. If you don't, I like to meditate. I recommend meditation, but I just kind of I had a meditative trance going on in my mind as I went in. I was like, I'm here. I'm only a few minutes late, and things are going to go on like they should. So I think that's important.
Yes.
Frankie on YouTube says he believes in snoozing 7 times.
Yeah, Frankie. Yes. I'm with you.
Yeah, I don't know about that. So other things, just other important things of day of, it's just decreasing
the anxiety. It's as much as you can. So for me, I am a huge caffeine freak. I love my coffee. It is really hard for me not to have coffee, but on exam day, I limit it because I get, a little shaky. It's going to get me a little riled up.
Well, as you know, of course, you're going to be a little bit more anxious, so then you're going to be releasing a lot more catecholamines. Your heart rate's probably going to be up a little bit, so then caffeine may exacerbate that. Now, as I'm sitting here drinking Red Bull, I can tell you, also, I don't necessarily recommend going cold turkey right before the day of. You should use, don't do anything in excess. And I've definitely for sure. What else you got? Wonderful wisdom.
I got my grounding exercises. So what I mean is breathing exercises, things that are gonna let me focus a little bit more when I'm kind of, I'm so nervous.
Yeah, I just like to meditate myself.
Yeah. That's a good grounding exercise. For those who don't really meditate, just deep breathing and holding it, taking a deep breath and holding it for 3 seconds and then releasing it really slowly. That'll bring you back down.
And that sounds so stupid. I'm sure people are like, oh my God,
they're like, deep breathing. No, it really helps.
But you really have to put yourself in a mindset of going in, you're going to be so stressed out, I'm telling you. And then, when you go into go actual for test day, and if you guys have taken it, standardized exams before, when you go in for the NCLEX in the Pearson View Center, you're going to be treated like a criminal. Everything about what you think is normal is not normal now, because like in America, I love America. I'm telling Canadians, but you are innocent until proven guilty, right? But when you're going into a testing center, they're assuming everyone is trying to lie, cheat, and steal everything that's in that exam. So you're going to get, you're going to have to show everything. They may actually be, they may do a metal detector. They may pat you down. They have to use a palm scan to actually check for the palm veins.
It's your way to check in and check out.
And that's okay.
Yep.
They didn't have that when I was.
Really?
Yeah, that didn't exist. But they, so for the med school exam, they actually use a fingerprint biometric, which you know, okay.
Mm-hmm.
But the point is, you're going to have, there's going to be a lot of things, and it's going to be very stressful, and you're not going to know. All of your things have to go into a tiny little locker when you go in. You're going to get a tiny key with a number on it. Don't pick 13, pick 7, because 7's lucky. No. But you're going to get a locker, and you're going to get that key, and that's all you're going to have. You don't need a calculator. You don't need anything. And let's say, so Marlee actually, we were discussing this earlier. Marlee actually wore a hoodie because she gets cold. I recommend. I took a light jacket that just zips up myself, and that's okay. But understand that you may have to take that off, and they may have to search it, or they may have to look through it. You have to turn out your pockets. It's very normal. So you're going to be treated like a criminal, and that's okay. They're not thinking you're cheating. They do it to everyone. And that's one thing I think that just skyrockets people's anxiety.
Oh, for sure, yeah. They told me, so I had my hoodie on, and my sleeves were rolled up, and they told me I had to roll down my sleeves, and that the camera was watching me, so because I would get nervous and want to just, hide in my sweater a little bit, but they were like, no, you can't do that, or we're going to come and take you out.
No.
So.
Well, and also just, they do monitor it, but this is not, I'm not saying it's like a, actual prison.
No.
But, it's just important. And if you get any type of things that happen, let's say you bend over and you need to reach for something or tie your shoe, it's actually pretty common. They're going to come up to you and check you. They're going to ask you if you're okay. And you just literally be honest. Don't freak out. It's okay. They're just checking, and that's your job. And they're going to, check. I had to tie my shoe. Now, if you're fiddling with your shoe 5 times during the exam, they may ask you to leave, and they may actually delay your score because they need to review the video, see if you were cheating. But if anything random happens, if things happen, you sneeze. You need a tissue. You just raise your hand. They're going to help you out. You need to fix your shoe. You got an itch on your foot. Marlee wants to pick her nose. Anything you want to do. Anything that you're going to do is normal, and they've seen it. You just got to be honest and just be okay with the fact that they may come and approach you with it and not freak out. But more importantly, take your breaks.
Take your breaks. Take them. They're so helpful, especially if you do feel like you're starting a downward spiral.
Well, I mean, I feel like at any point, once you get the NCLEX is tough because you're not getting that break until a while in. That's a pretty long time. And if you've not practiced taking that many questions for several hours at once, I mean, that's a lot of time, and you're going to feel very anxious and very tired, to be honest.
It's true.
So you need to take that break just to refresh yourself. But regarding breaks, what do I always say about the breaks?
What do you always say about the breaks?
Well, maybe that's because I'm going to tell you right now. No, when you go on a break, one thing that's really important, if you should not be bringing any type of review material into the testing center. That's a no-no. That's a big time problem. But even more importantly, a lot of people, you may be able to leave. You may be able to leave the actual testing center. So you go to the bathroom, you review. What you don't want to be doing is grabbing your phone and trying to look up something that you had that you couldn't remember to see if you got it right. So all that's going to do is throw you way off. Because the likelihood, if you have to look it up, you probably got it wrong, and that's okay. Remember, these questions are designed to be somewhat difficult. I think they actually make all the questions with probability of 50% you getting it correct. So they already know that questions are difficult or may be difficult. So if you go out and try to go to your car and look in a book and review something, it's only going to mess with your mind so hard.
Stay focused. Take a couple, just get out of the situation a little bit, but you want to stay focused, and you want to be able to walk back in there and know that you're just going to recenter.
Yeah, I think that's super important because you got to really stay on task. That's so important because you're gonna get into this a lot. So just a couple things as far as aftermath, and Marlee thinks that afterwards you got to distract yourself.
Totally distract yourself. Don't even think about the NCLEX because you do have a waiting period. So what are you supposed to do during that waiting period?
Well,
you got to distract yourself because you're gonna go crazy.
Yeah, I think obsessing over looking up things is a bad idea. I usually like. And I know this sounds weird, but I actually journal after every single one of mine.
Yeah, that's what
after every single big exam, and I've taken a lot of standardized exams, okay? I've taken paramedic exam, nursing exams, med school exams.
You just love your exams.
I just love exams. So I feel like I am a professional standardized exam taker. But And Ryan says get drunk on YouTube. But no, you should, celebrate, yes. But I like to journal. It just kind of helps me kind of de-stress and think
it's
about
a reflection.
how bad it was. And I went and read those not too long ago. Let me tell you what, they're pretty rough. But that's okay. But the big thing is, how long is it going to take to get your results?
Yeah.
Now this really depends. It's a variable, but it's going to take a couple of weeks unless you pay the extra $8.
Yes. So there is some
$18.
states. There's a select amount of states. It's $8, and it's called the quick results, I believe.
Yeah.
And some select states have it, so you can pay the extra money and get it in 48 hours. Others, you have to wait 10 days.
Now, if you had any kind of deviant behavior, as if you were, tying your shoe 6 times and they had to review the tapes, your scores may be delayed. And sometimes, also, it's just also important to know that sometimes the scores are just delayed for a couple of days because they update, question banks, they do other things, and there just may be a little bit of a delay. Every single time I talk about scores, everyone always asks, does the Pearson VUE trick work?
Oh my gosh.
This is like the biggest thing on the internet. I don't know, and here's what I can tell you. As of right now, as far as I know, yes, the little trick works. You can go and try to re-register, and it's not going to let you re-register for the exam. I don't think you need to do that. The scores come out so fast now, but just keep in mind that could change at any time. So it's not a guaranteed thing.
It's such a risky thing to depend on,
Yeah, I know. Pay the extra money. Yeah. If you're one of those people that can't wait, just pay the extra money and get it. Some of the YouTube comments coming in, Colette says she thinks she died a little bit on the inside and wanted everyone to leave her alone.
I know.
It's okay. Everybody has their own thing for it. Personally, after I take an exam, I really like to have some alone time. Because I just don't want everybody bugging me like,
really?
How'd it go? How'd it go?
I need to surround myself with tons of people.
Yeah. So afterwards, one of the things is how do you think you did? And if you finished at 75 questions, I think most people can really kind of know whether they did okay or not. If you cut off at anywhere short of 100 questions, it's like if you're less than 100 questions, you should have a good feeling of whether you really knew the content or not. And I mean, I think you should. I believe that. I feel like after I passed, I thought I bombed it, but I mean, I say that, but I knew that I was getting questions that I knew. But I always tell everyone, it's like, I think I did horrible, just because in case that I actually did fail. I don't want to have to face the reality that I'm like, I think I did okay, and then I actually failed. But no. So the important thing here is, if you had to do all the questions, if you do fail, and this is something that is Marlee wanted me to make sure I mentioned in here, you're going to get your candidate report. You only get this if you fail. You only get the report. I forget what the actual name of it is, but
it's the
candidate performance report. You do get that report, and it's going to tell you the areas in which you are near passing standard, below passing standard, or above passing standard. And what's important is to take that report and add it to your repertoire of whatever you use to study, and then take a deep breath and make another plan. Because the further you go, the more problems you're going to have down the road. You can't ignore that. That's a very important piece. I talked to a lady a year ago, and I can't remember her name. She wrote in, and actually, we had there's 2 students have done this, and they wrote in, and they said, I failed. I don't know what I'm going to do. I mean, it's a very horrible feeling, I'm sure. And I failed exams before. Let me tell you what. But I didn't fail the NCLEX. But I have failed some exams before. But if you fail, it's devastating. I mean, it's just a huge blow. And what happens is you really have to take a hard look at yourself and kind of be introspective and say, why'd you have trouble failing? Or why'd you have trouble answering the questions? Where do you think you failed? Did you have trouble with the content, choosing the most correct answer? Did you just freak out during the day and lock your keys in the car like somebody else? Which one? Or maybe it's a combination of both, or all 3. But what you got to do is you just kind of got to take a deep breath and then make a new plan, because that's the only way you're going to get done. make a new plan, set a new date, and then just kind of evaluate yourself, maybe with a little bit more scrutiny as you go through. Now, what's important and what I love, I always get some really doozy questions.
No, I love the questions.
This one, first thing right away is from YouTube. I think it looks like Frankie. Frankie asked about, are there Picmonics about pharmacological drug classes? Now, I can tell you right now, Frankie, if you go check out Picmonic, check out some of our other videos. You can go to Picmonic, or our YouTube channel. It's Picmonic Video. You can also find myself on YouTube and whatnot. But you can check out Picmonic Video, and you're going to find there's a great three-part farm series, which is actually going to go through tons of drug classes and give you a great idea of just how powerful Picmonic is to help you remember. We have 187 different drugs inside of Picmonic to help you memorize. And one of the common FAQs on NCSBN's website, which is funny, this came up, but is there a standardized drug list that they need to know? The answer is no. Because they can pick anything.
Yep.
They can pick any drug possible that they want. But I can tell you they're going to pick the most common ones because when you're doing nursing and they're testing you, they don't want you to know these minute, crazy details as much as they really just want to make sure you know all of the basics. And can you provide good care, right?
Right, and that's what's scary about it is you think you're entering into this world of like it could be any drug, But really, I mean, Frankie, Picmonic helped me so much with Pharm, and that's what really saved me in Pharm going into my NCLEX. So.
Making sure you know all the big ones. You can Google the top 200 drugs. You can check out Picmonic, and actually we've got all of the top 200 in there. But there's 187 different drugs, and knowing the drug endings is really important.
Yeah, and Kendall does an awesome webinar on that.
Yeah, it's fun. It's a lot of fun. Yeah. But Marlee edited it. That's why she says it's awesome. But no, it's knowing the drug endings is really important. So if you know the OLOL ending for beta blockers, then you've memorized all the beta blockers as beta blockers. So that's what's really important. So let's see what else we got here. First question. We got several questions come in. So Amy writes in. She says, "Is near passing standard mean not quite there yet?" And I think that's self-explanatory. But yes, what it means is that means you're based on this the 95% confidence interval or the standard passing line that comes all the way across, that means you're just not to the level for that particular area. So it's really hard with some of those areas to really figure out like how do I just study this area. But I think you could kind of divulge from that. And if you've got anything else, if you're not near a passing, you're near the passing standard on like a HESI or an ATI or Kaplan predictor exam, great, because then they're going to give you lots of details of what you need to do to learn from that. But if you're having trouble, if you fail the NCLEX and you get that, you're below the passing standard or near the passing standard, then it's a little bit more difficult to understand. But you can download the student the candidate performance report, or not candidate performance report, the candidate. There's a candidate report which tells you all the areas inside of NCSBN. So like all the content areas.
Oh, I see what you're saying.
And it's going to give you a little bit more info. Some of it just doesn't. Some of it I feel like it's a little bit of blah, but it might give you a little bit more insight if you don't have something like a Kaplan or an ATI or HESI to rely on there. So so actually Paulina actually asked so it's the test plan is what I meant, what I was trying to say. Yeah. So can we create NCLEX study paths for dividing all of the Picmonics for the test plan? We get some different requests for this, and we've not done it because it turns into a hodgepodge of nothingness because everything overlaps in reality, especially as we do Picmonics for one particular drug. So we'll do a drug or a disease. So let's say we do Cushing's syndrome. Cushing's syndrome's an endocrine disorder, Cushing's syndrome and Addison's. Well, we can't design our topics by study plan because I can't put Cushing's into into like management of care because I don't have a question written around that. So it's really hard for us to do that. But there is there's lots of most of the review courses are designed to help you around this type of thing as well. This is a pretty common question we get. Yeah.
Sorry, I'm like.
Did you not wear your glasses today? Your contacts. Anna asks, how much would it be percentage-wise percentage of passing the area is when you're practicing questions. Is 80%? How was it during nursing school? And this is a common question, and this depends on the question bank. Because I'm surprised I didn't get the question yet about what question bank should I use or which review course. We get that a lot. And this just depends. So there's lots of review tools out there and review resources. You know, if you're doing a more difficult question bank, such as UWorld, UWorld's a big med school question bank that then has just recently moved into the nursing realm. Good people, love them to death. But their questions are notoriously difficult, and that's a good thing. So if you're doing something like a UWorld and you're doing these question banks, what's important is almost all these question banks. I know UWorld does this, and yes, I know UWorld's a little bit expensive, but it's going to give you the algorithm is going to show you where you stand and where everybody else is. So maybe you only got 60%, but all of the other people who are using UWorld are at 50%. That means you're 10% above the average, and that's good because you're above average, and that's where you need to be. So if you looked at that, then you should just be at the average or above the average to be in the clear, as we're going to call it. If you're doing straight recall questions and you're just recalling facts, yeah, I think you need to be at 80% or higher. It just depends on what the types of questions are and where you're pulling those types of questions from, for sure. What percentage would you consider an overall to be ready for the test? Dana, I think the same thing. Again, it depends on the question bank. Where are you doing it, and what?
That's a good one.
Yeah, Namada asks one of our favorite questions.
How do I prepare for this? Select all that apply my weak areas. Yes, I believe that is everyone's weak area. Select all that apply.
That's because select all that apply questions are multiple topics that you have to know multiple things to get the question right.
Yep.
Right?
Yep.
And we have a great, you can check out our YouTube Picmonic video on YouTube, and it actually has the thing right in there. You can actually check out, we've got a video on how to answer select all apply. We give some example questions and really dive into why are you not getting these correct. And it's hard. I'd like to think that I'm not mean.
But it goes back to exactly what you were saying. Is it the content? Is it the reading the question that you don't understand? Or is it anxiety over the fact that it's a select all that apply?
Yeah.
You know?
Yeah, and you can go check it out. It's a free webinar. But most of the time I see that select all that apply questions, people just don't really have a good grasp on the content, and they're just good test takers. So they're trying to guess. And if you're a good test taker and you're just a good guesser, when you get a select all that apply question, you're going to miss all of them because you've got to know the content because you have a knowledge deficit, and that's where we see that. The next thing, Brandy kind of asks a little bit of a complex question, but one of the things she says, what are allowed to do during breaks? She talks about breaks, what you're allowed and not allowed to do during them. She's kind of scared to even pee during a break because she doesn't want them to think she's cheating. Brandy?
I like this question.
I'm glad that you are worried. That's good. But you don't need to be paranoid. So let me tell you just a couple of good things. Don't take any kind of review resources or anything in that you need into the testing center. You really don't even need your phone. I've heard a horror story of somebody who left their phone during the testing center and their car got broke into and they lost their phone. Okay. That's a rare example. But I do a lot of webinars, Marlee. I hear these stories. Okay. But anyway, the point is, you could actually leave everything you need in the hotel or in your car, and all you've got to walk into with is your ID, your authorization to test, and a good attitude. And then what are you allowed to do during the breaks? Well, the breaks are they're optional. You can take them yourself. So you take your 10-minute break. And you can go pee, you can do whatever you want, but just don't do anything that you shouldn't be doing. It's just like, should I be going and go to the bathroom? Yeah, it's fine. Don't be grabbing your phone and pulling it out. Don't pull a review book out of the locker, stuff like that. That's problem. Those things are problematic. Those things are going to get you in trouble. Mel says the last time I probably shouldn't say that, but she says she had questions about adalimumab, and adalimumab actually is a pretty common medication. So It's important to know that you could get a question on any type of medication. So even adalimumab, which you probably should know, adalimumab, it's inside of Picmonics. Inside of our Picmonics, you can check it out. Let's see. Ricardo asks, is the Picmonic info detailed enough to pass? It is detailed enough for you to know all the information. We can't make you think, though. That's what we always say. You need to have a question bank to supplement along with it to see if you really know how to apply the information. But as far as recalling all the facts and all the information you need to know, we do the best job at that of anybody. I can tell you that for sure. Let's see here. Got a couple of questions. I think Linnell just called me Matt, but my name's Kendall. That's okay. So somebody asked about NCLEX being graded differently depending on states, and that's actually incorrect. The NCLEX is graded nationally. All the information is graded in one central database, and all the information is from one place. So you're going to take a very similar test as somebody who is in, if you're in Ohio versus Colorado versus California. It's all part of the system. It's all one standard, that's for sure. Lee asked about a HESI of 850, and I think Lee, the HESI of 850, I think HESI actually, that's their recommendation that you're going to pass with a 95 percentile or whatever is at 850 or 900. I'm not sure which one, but at 850, I think you're, if you get an 850 today, I think you're just a couple of weeks away from some quick review to be able to just schedule your NCLEX and go right away. Just as long as you don't, get an 850 on your HESI and then just go for a party for 2 weeks and and then you don't do anything and then you go and do it. I think that's great. Monica says about what plan would you suggest if you're using Picmonic to study along with a review course? She'd like to utilize both and about 100 questions a day. We actually have an NCLEX study plan you can download for free. It is a resource that kind of helps you out, guides you into laying out all the Picmonics. But I think that's a great plan. I think you can study those. You got to pick a date and pick the day when you need to do things and what you should then divide those questions out per that number of days. Amita asks about what's the best review book. Now, the best. This is subjective. Marlee likes the Saunders book.
I do. Yeah, Kendall doesn't.
Well, I don't hate it.
I know. You don't like it as much as I do.
I just, I found the Saunders book to be a little bit, it has lots of questions that I think you can use apps and other programs to do the questions. I think it's good for content, but I actually like, I prefer the HESI review book. You can Google HESI NCLEX book. I really like that one because it's bullet pointed. It's very succinct, so it's very to the point. Only what you need to know, and all the other crap's just literally thrown away. But with that doesn't mean you're not going to get things that you're not going to get. Let's see. Ooh, another book question. So question banks, we get this question a lot. Question banks, which question banks should you use? Now, this is, again, Marlee.
Subjective again.
Yeah, Marlee likes the Saunders, question bank and what they have. You can download that, and I think there's lots of different options out there. Now,
I used Kaplan.
Yeah, so Kaplan's, as far as their question bank, Kaplan I recommend all the time. If you have trouble answering, when you have to talk about your weaknesses and you have trouble, how do I answer the questions? Kaplan's the best. Because their question trainer is the best way to teach you how to think through how to answer the questions, how to pick the best answer. Right. So if you have trouble with that and not knowledge, Kaplan is the best because I find the rationales are kind of lacking.
It was nice training my brain when I hadn't been doing the questions, so it was a good training. Like you were talking about the marathon, it's like doing the test runs. Just training the brain. So I appreciated that a lot.
I like Kaplan for that respect. I actually like the NCSBN learning extension. Their website, and I have talked to them over there so many times, their website is not responsive yet. I think it's supposed to be mobilely responsive. Like literally, they just said it in SNA that it's gonna be happening really soon. So you have to use it on the desktop right now,
Yeah.
and you have before, but it's going to be updated. They're just a little slow.
Yeah.
But it's part of NCSB, and I like their stuff a lot, so I recommend it all the time.
Yeah.
And even though it's expensive, I recommend UWorld, just because it is going to be the hardest one. It's going to beat you up the worst.
Mm-hmm.
If you get beat up the worst when you're just practicing questions, and you make it through that, then I think you got the best chance of success.
Exactly.
And of course, we just found out when we were in SNA, again, that Hearst actually now
they do have a review.
does have a question bank that you get when you get a part of the Hearst review. So that is another thing that's out there. But you can use the books, and also lots of people ask about NCLEX Mastery, the app. I think that it's okay. I don't have anything really negative to say about it, but I don't believe that it's should be used as your primary resource.
I really liked it for the reason of being on the go and being able to just do it on the go.
Yeah, I think that's. I think that's a good thing.
It served its purpose.
Yeah,
there.
I think it's lacking a little bit in reporting.
Yep.
But I think just be able to just test yourself on content, I think it's great.
Yeah.
And I definitely think that's good. Definitely for sure. So.
Fernando asked if we plan to wear blue shirts. Of course we did, Fernando.
Well, we didn't really, but Marlee always knows. I only have like a set of number of questions that I use. Ashley asked about Elsevier's adaptive quizzing. Now, I'm going to be really honest, Ashley. I am not familiar with Elsevier's new adaptive quizzing modules that they have. I've heard mixed things on it, and what I mean by that is I've heard good things and I've heard some meh things. I am a little partial because I have been helping in the Elsevier ecosystem a lot, writing test items for Elsevier, but I can't really comment on their adaptive quizzing. I can't say anything really good or bad, but I'm sure, what I can tell you for sure is Elsevier is absolutely going to be sure on making sure that it's accurate. So I really can't give good examples for that, and I apologize for that for sure. Anyway, so I can't. I wish I could give more information with that, but anyway, I think that's about it, guys. We got some other just random questions and things. I don't think we've got too many. There's some random ones, and I'm sorry. A couple of people on YouTube are asking some just bizarre things, so I think we're just we're in weird land. And I'm sorry we went way over time, but what's important to know is you can check us out on YouTube at Picmonic Video. You can check myself out on YouTube. Just Google me, Kendall Wyatt, and YouTube, whatever. You find my stuff. But we've got lots of stuff on the internet out there for you, resources. If you have trouble with content and memorizing stuff, and even if you're about to take the NCLEX, you can memorize all the lab values. You can memorize all the electrolyte balances. You can memorize 187 drugs in just a couple of weeks.
Yeah.
Or whichever one you have trouble with. So if you have trouble with content and memorizing content, I think our system is the best for memorization. But applications still need a good question bank, and you can use that yourself. And hopefully we gave you some good tips and tricks. If you have any questions, you can always write into us at feedback@picmonic.com. If you didn't like our blue shirts, well, you can write in about it, and you can tell us everything you want. We're here for you no matter what. Feedback@picmonic.com. You can write in. You can complain. We don't mind. We like the good feedback and the bad because that only makes us better. But other than that, guys, we appreciate you joining in. And I don't think we have too much other than that. But anyway.
Thanks for joining.
Check us out on YouTube. Go to picmonic.com/webinars to always check out our videos. Unfortunately, this is definitely one of my last few webinars with Picmonic because I'm going off to residency to go play doctor. So I won't be able to do so many crazy webinars with Picmonic as of now. So have a good night, guys, and we will catch you guys next week with. I can't remember. I don't even know what we're doing next week. I can't even remember. There's so many. But we'll see you next week. Have a good night and good luck studying.
Bye.